So we got this middle-aged male in our emergency, and he presented with the symptoms of shortness of breath and palpitations. And on examination, he was found to be having refractory symptomatic bradycardia. Now, why refractory? Because this bradycardia did not respond to usual atropine doses, which is the recommended first-line treatment for bradycardia according to ACLS 2020 guidelines. Why symptomatic? Because the bradycardia was associated with hypotension and decreased organ perfusion. So the next best recommended step according to ACLS guidelines is the application of transcutaneous pacing. So this is the transcutaneous pacing which you are seeing in this video. The application of pads is very similar to the application of defibrillator pads, one on the below the right side clavicle and the second pad on the left anterolateral chest wall. But there are a couple of things that you have to remember in this case. That one is TCP is a temporary measure, so you have to evaluate the causes in a detailed fashion. You have to send a cardiology consult and look for whatever caused the bradycardia to the patient. And another is that this maneuver is very painful to the awake patient, so you have to give sedation or analgesia to the patient, but ensure that the patient's airway is protected, and you otherwise you will lose the patient because of the respiratory compromise. And the third and the last is that always check the pulse while you apply a transcutaneous pacing, because sometimes on the monitor only electrical capture is being seen, and but mechanical capture is absent. So you have to regularly check for the pulse whether the that transcutaneous pacing is delivered correctly to the heart. So read about it more, and you can ask your doubts in the comments. Thank you.